Hello friends, my name is Mini Chaturvedi and welcome to the Mini Medical Biology. So guys, topic for the today's session is quite interesting and very important for all of us. So that is diabetes and black fungus. So in the today's session, we are going to learn that what is the relation of black fungus and diabetes. Now you have already seen it that how many cases are rises of black fungus and it is more affecting to the diabetes people and as well as the COVID-19 patient. Now let's see what is the relation between diabetes and black fungus. You know what actually happened is that the patient who have pre-existing history of diabetes are suffered from the COVID or the post-COVID recovery are more suspected for Mucor Mycosis or black fungus. Basically, the mechanism is COVID-19 will reduce your immune system activity and prolong diabetes, also suppress your immune system, and that helps Mucor Mycosis infection to attack your body. Now, I'll show you the data till March. Almost 101 cases of black fungus arises from worldwide, and you can see that majority of the cases are from India alone. I mean, almost from 101, almost to 82 cases are from India, and that is really shocking to know that. I know that you also want to know that why India is the hub of black fungus and why majority of the cases are from India. Why it is declared as epidemic? So you might have some kind of question. So for that, we have studied all those 101 cases and we found some similarities among them. And that I'm going to discuss with you. So some research articles or studies concluded that 80% of the patients with the black fungus disease that having the pre-existing diabetes history and 14.9% of the patient have DKA. What the DKA is, that is diabetes ketoacidosis. It is also a one type of diabetes. And third more important thing that is came out, it is 59% of the patient are COVID active and 40% of the patient are COVID recovered. And 76% of the patient are on the corticosteroids treatment. And you know what? This corticosteroids has a special role in attracting the black fungus, and now you can see that India has the more prevalence of Mucor Mycosis, and reason behind that is India is the second largest population with the diabetes mellitus. And you know what? This is the leading risk factor for the Mucor Mycosis. So first reason is that your diabetes, that the mechanism behind that I'll discuss too. But before that, we need to see that what is the primary reason of black fungus cases in COVID-19 patients. Okay, so let's see that. First one is your low oxygen. As you can see in the COVID-19 patient, the oxygen saturation level get low and body gets low oxygen supply, and this is the most preferable condition for any fungal pathogen to grow. Next one is your high glucose. So high glucose is the source of energy for pathogen and it will activate your body. Basically, the high glucose will activate your fungal pathogen with more power and work faster, and that cause harm to your body. Similarly, black fungus is opportunistic, and high glucose in your body is a great source for attracting the black fungus disease. Now, next one is your steroid-induced hyperglycemia, because the intake of steroids could lead to the increase of glucose in your body and increase ferritin. Release of free iron also attracts the pathogen, and other reasons are malignancy, organ transplantation, prolonged hospitalization. These all are the reasons for the rise of black fungus cases in the COVID-19 patients. And now let's talk about the mucor mycosis in people with the COVID-19 in relation to the corticosteroids. Do you know that corticosteroids has a special role increase in the black fungus disease? Now, look at this mini description which will explain you the relation among diabetes, COVID and steroids. See, we have seen many cases diabetes is triggering the COVID-19. Because why it is so? Because diabetes is a chronic condition and chronic infection will suppress your immune system and it will become weaker. And weak immune system will give benefit to the pathogen, and all kind of pathogen, whether it is fungus, bacteria, will get great opportunity to attack your body. And that is why the diabetes patients are more susceptible to the COVID-19. And you know what, one more thing, diabetes is associated with the hyperglycemia, and high level of sugar will increase the virus activity, which further suppress your immune system more. And now with the patient with COVID-19 and giving steroids treatment helps in suppressing your immune system and trigger hyperglycemia. See, patients are giving steroids treatment, and steroids also help in suppressing your immune system and as well as also triggering the hyperglycemia. So how steroids work, I'm going to tell you the mechanism behind that. In steroids, what happens is basically it triggers your immune system. Immune system is composed of white blood cells. So what steroid will do is it will reduce the phagocytic activity of your WBC in your body, and that makes your body, when your phagocytic activity of your body get reduced, that makes your body more susceptible for the secondary infection. You know that virus is already present in your body and immune system is low now, and also you are on steroid too. So all these conditions are make you more and more susceptible for the fungal infection. Now let's talk about the free available iron. Free available iron is also a ideal source for mucor mycosis. How your body is generating the free available iron is, see, your body has hyperglycemia condition, suppose. So hyperglycemia can cause the glycosylation of transferrin and ferritin, so which reduce the iron binding capacity and release the free iron. As well as, now let's see that diabetes can also develop diabetes ketoacidosis. And ketoacidosis itself suggesting that acid is presenting in your body, which will drop your body pH, and low pH is also a preferable condition for the growth of black fungus, any other pathogenic infection. So I have discussed all the possible reasons with you of this disease, and now let's see the conclusion part. So what is the conclusion behind that? First of all, you need to control your diabetes. If you're controlling your diabetes at first place, then you can prevent yourself from the suspicion of COVID-19 as well as the black fungus. Now, reduce the unnecessary steroids treatment, because the reason behind that we have already discussed. And next one is your maintain sanitization. It is very important that fungus can develop easily at moist and damp and unhygienic areas. So fungal infection can also spread from the hospital, and maybe unhygienicity and lack of sanitization is the main possible reason for that. And do not use the same mask for prolonged time, because it also increases the chance of unhygienicity, and it also increase the chances for the fungal infection. So at last, I would say if you will follow these mini conclusion tips, then you can prevent yourself from the black fungus and COVID-19 infection. So if you like this video, just share as much as you can and subscribe to my channel.